And we're live. Thank you and welcome back to Corona Conversations with Jay Allred, President and Publisher of Source Media Properties, Richland Source and Ashland Source here in Mansfield, Ohio, and Knox Pages in Mount Vernon, for a conversation with some folks in the healthcare industry and about some things that we all have on our minds. We knew that this was going to be an important conversation, and we're really glad to have some folks from two of our premier healthcare systems here with us today to chat for a little bit and also to take your questions. So we're gonna start real briefly by thanking our members, our newsroom partners, corporate partners, as well as the Facebook Journalism Project for supporting this work right now and helping us bring this series of conversations to you. We couldn't do it without them. If this kind of local journalism is important to you, you can see that support our reporting button in your window. And if you smash that button, as they say on the internets, you can take a look at our membership program and potentially help us continue to bring this to you. But we're going to move on here and allow our folks from University Hospitals and OhioHealth, Mansfield, and Shelby Hospital to introduce themselves. I'm really excited to be joined by Kathy Whitmer and Jen Hegman from University Hospitals and Dr. Gavin Baumgartner from OhioHealth. And Kathy, how about we'll start with you and then move to Jen, and then Dr. Baumgartner will let you guys introduce yourselves. Thanks.
I am the Manager of Communications and Development here at University Hospitals Samaritan Medical Center. That means we are over marketing and communications. I also oversee community outreach and the volunteer services. And since we've been in the HIC structure for this pandemic, acting as public information officer also. Good. Jen?
I'm Jen Hegman. I'm a registered nurse here at Samaritan Medical Center. I've grown up here. I've been here 27 years. Currently the manager of quality risk infection prevention accreditation. I'm acting as the infection preventionist right now for Samaritan, in addition to the HICS position of medical technical specialist.
Good. And I'm Gavin Baumgartner. So I'm the Vice President for Medical Affairs, OhioHealth, Mansfield, and Shelby. So in internist by training, I've been with OhioHealth for about 20 years now, worked as a hospital medicine physician in Columbus. I've been up here at Mansfield and Shelby for about 2.5 years in the current role. Thanks for having me.
Yeah, and thank you all for being here. For those of us that have been on coronavirus conversations before, we're going to keep the format really similar. We try to get you in and out in an hour, and we're going to roll off into what's going to be a guided conversation for the next 20 minutes or so. And then we're going to open this up to your questions. If you're joining us today on Crowdcast, make sure you can either use the question function and you can ask your questions at any time during the conversation. You can also drop them into the chat. If you're joining us on Facebook Live today on either Ashland Source or Richland Source, my colleague Brittany Schock is with us. Thank you, Brittany. She's acting as our producer and our community manager, so she will be helping get your questions to me, whether you ask them on Facebook or on Crowdcast, so that we can get them answered toward the back half of this conversation. So I think I'll start with just kind of one of the questions that's just on everyone's mind. All signs from the state government, from Dr. Acton and Governor DeWine, and from the Trump administration have been pointing toward a peak in the coming weeks, and perhaps lingering cases through the late spring and summer. This is really valuable information for folks in our region to have, but one of the things that we've been asked over and over again is they're not exactly sure how ready we are. So in Ashland and Mansfield and Shelby, that's really been a key question, is that we understand that the peak is coming and that at some level or another it will hit us, but we're not exactly sure how ready we are. Could you guys speak to that from your hospital system's perspective? How ready are you?
Well, I can say from Samaritan, I don't know that any of us are going to ever be able to say that we're totally ready.
Sure.
But we actually started planning for this back in January and have officially been in HICS, which is Hospital Incident Command, for the last month, over a month. So we are, I think, as a hospital, getting prepared. It's all going to depend on the surge. I will also say, I think in Ashland County, we had our first confirmed case 2 weeks ago, 2.5 weeks ago. And generally, most places we're seeing those numbers double every day. And I think I heard this morning Public Health announced we only have 3 confirmed cases in Ashland County. So, you know, I think we are doing a good job as a county, as a community, of, you know, staying at home, obeying the shelter-in-place orders by the governor. And then as a hospital, that gives us more time to prepare, more time to secure the personal protective equipment that so many hospitals are, you know, we don't have adequate supplies. And just setting up all of the other plans that are necessary for a pandemic of this size.
What is HICS?
HICS is the Hospital Incident Command System. It's a national system for emergency preparedness for hospitals. Most of the country uses it. So it's common language throughout the United States for hospitals.
So it's sort of a way of understanding that a hospital is preparing for an emergency or a potentially, you know, an unusual situation.
Yes, common terms. You know, when you hear things happening out in California, you understand it a little better because we are talking common terms, common ways of operating, FEMA, the national stockpile, those types of things.
Dr. Baumgartner, same question for you.
Yeah, so I think much like was articulated, I don't think any of us could say that we were fully prepared for something like this 3 months ago, but I really appreciate the response that we've had here locally within the system, regionally, statewide, and nationally to the crisis. So I think that we've rallied. We've been in incident command as well. So our command center has been open for close to a month now, and is staffed now pretty much around the clock, both in person and virtually. And we're really in that surge planning stage, and we've been there for a couple of weeks. I think much like everybody else around us, we've been really looking at how do we increase capacity, how do we redeploy staff that their jobs may not necessarily exist at the moment in certain areas. How do we redeploy them to help us battle this virus? And we've really spent a lot of time and effort on building our resources, both with people, things to help fight it, and then expanding places on our campuses to help us potentially house patients affected by COVID.
Any idea how, like, if you had to take a guess at both of your hospital systems on a scale of, you know, either a percentage or a scale of 1 to 10, like how much of your resources right now are being dedicated to preparing for COVID-19 and all of the other things that you have to do? Have you moved, you know, if 100 is the biggest number, are you at 125 right now? Because you can't, I imagine that you can't stop caring for patients and people with heart problems and broken legs and, you know, burn victims or whatever takes a person to a hospital, they still are going to go to a hospital. So this kind of capacity that you have to take on has to be enormously daunting. I'd love for you guys to talk a little bit about that on the theme of readiness and what that's putting your medical crews through. You know, your clinicians. I think a lot about those clinicians, and I don't know if that's because of the, you know, what I see on the news on a pretty regular basis, but talk to us a little bit about that.
So at university hospitals, if I had to put a percentage to it, I would say probably at least 80% of our resources and staffing is geared towards COVID right now. As you said, we still have our regular patients and have to care for them. What we've been able to do is when we postponed elective surgeries, the surgery nurses immediately began to cross-train to ICU or the emergency department. When our athletic trainers, because the schools closed, really didn't have a job, we trained them to be the screeners at the main entrance in the emergency department. A lot of cross-training is being done in preparation. I don't think we have anybody on low census as those jobs become, not as needed. We transfer them to something that'll help with COVID and trying to prepare for that surge. And
lots of cross-training efforts, not just to the screening and the team for COVID, but even cross-training into the kitchen, because if those staff get ill, we need to have the resources available to take care of the patients and feed those patients and individuals. So any place that we have the ability to cross-train and make sure we have coverage of those areas to continue to provide care.
Yeah, and I think at OhioHealth, Mansfield, Shelby, and throughout the system, we've seen much the same. So with our leadership teams, I agree it's 80 to 90% of our jobs. If I just go by how I feel, I probably spend my day, it's probably 80 to 90% thinking about COVID and preparedness, surge planning, how we get folks trained up. Now, our frontline staff, still, as you mentioned, they have to take care of other patients that come in with pneumonia or heart attacks or strokes, broken bones. And so their time is being spent a good bit taking care of those non-COVID sick patients, while in the background, we're still kind of preparing them, retraining, getting them the right protective equipment and making sure they know how to use it, and really kind of preparing in the background while they're still trying to take care of those non-COVID sick patients.
It really sounds like almost a military operation in terms of how you guys are having to flex and mobilize to react to this.
Yeah.
Very much so.
Yeah, the incident command is really based off of that federal, the military kind of model, and it really, you start making command decisions, and we all follow that same structure because it provides you a framework for how you really address these, so that you don't kind of devolve into chaos and which sometimes happens in disasters. We use the same incident command if there's a tornado that hits Shelby or a multiple car accident or buses that crash, that we will open the same type of incident command so it can deal with all kinds of different disaster scenarios.
So today on April 3rd, what should our readers know? What should North Central Ohioans know about COVID-19 testing in Mid-Ohio? What should they know about it? Help us understand the current events.
Currently, the testing capabilities in the UH system exists. We at Samaritan Medical Center are collecting the specimens, and those are then transported to the UH main lab for processing. The prioritization of those tests includes what's recommended by the ODH, or Ohio Department of Health. So we're primarily testing patients who come in with symptoms and have the clinical picture indicating a potential COVID situation. We're interested in testing law enforcement, healthcare providers, first responders, because if those individuals get sick, we obviously have another crisis on hand as to who's going to care for the rest of the community. The testing, again, is sent north to the UH main lab, and the turnaround time has decreased significantly in the last week or so to anywhere from 24 to 48 hours, depending, because there's two tracks in which those tests are triaged. There's an inside lab at CMC main, and then there's a transitional lab, which is also part of UH, but not in the main system. So they have two capabilities to process. So,
can you give us a sense of how many folks you're testing, either on a daily or a weekly basis at UH?
For the month of March, I believe we sent out around 80 tests.
Okay.
I'm seeing anywhere from, and it's fluctuating. So I've had days where I've had one test patient, and I've had other days where we've had 10 test patients.
Mm-hmm.
And at OhioHealth, so we've, I'm sorry, did you want to, was there a follow-up?
Okay, go for it.
So with OhioHealth, we, much the same, we do some testing both through patients that come in through our emergency room as well as hospitalized patients. We can do COVID testing. And for that, we've used the ODH, Ohio Department of Health lab. For a short period of time, we were using an outside reference lab, but we've stopped doing that. We now have the ability to do in-house testing as well, and that's centralized down in Columbus. We're looking at doing the point of care testing, developing that capability as many hospitals are, as those tests are released by Abbott, and many have seen that released in the paper, actively developing that. So we can send both to ODH and do in-house. The turnaround time has gotten better, I think, as everybody has seen from 3 weeks ago to now. Turnaround time is less than 24 hours on our in-house test, which has really been a game changer for us. Does give us the ability to then release some folks from the hospital that we were holding on to for days at a time. So in addition, the other feature that we've set up here in Richland County is that we've now, for a couple weeks now, we've actually offered ambulatory or outpatient testing. And this is the drive-through model that you've seen probably on the news when people watch nationally or locally. I think they have it up in Cleveland and certainly around the country. So we offer a drive-through testing facility here in Richland County. We don't take walk-ups, so they're referred on through their primary care physician.
So that's an important point. This is not something that I can just leave my house today and decide I'm going to go get a COVID-19 test.
No. So yeah, my advice is that if you're have mild symptoms and you feel like you might need to be tested, call your family doctor. We've distributed the testing information to all the primary care physicians. So we're offering this to both OhioHealth employed physicians as well as independent and non-OhioHealth physicians here in the area, and they'll call their family physician, who then calls a hotline that we staff 24/7, and they screen the patient to make sure they do in fact meet criteria per state and federal standards for testing. And then they literally drive up in their car. Somebody comes out in full personal protective equipment. They swab them, and then we get the result back to them. And again, the time varies because we do, with some of those, we still send to our ODH, Ohio Department of Health lab. Some will do in-house. We are prioritizing the in-house labs to some of our sickest patients, as well as healthcare workers that may have been exposed as well. So we're proud that we've been able to offer that to the residents here. Otherwise, they were having to either come into the ER, which we don't want to have them do, or actually have to travel down to Franklin County or up to Cuyahoga County to be tested.
Any sense of how many tests have been conducted by OhioHealth?
Yeah, so we don't release the number of tests that we do, but we've actually had we've seen some fluctuations in the outpatient testing area, the ambulatory drive-through testing, but we have seen a pickup in the last couple of days, which we'll just have to track and trend that. And then in the hospital, I think Richland County has had 8 confirmed cases so far, and certainly many more tests than that.
To echo off of Dr. Baumgartner, we also are doing outpatient testing, but again, very limited based on symptoms and the referral source. Our referral source for the outpatient testing mostly has been the Ashland County Health Department. So individuals who call the Ohio hotline, who are then screened and recommended to be tested, those are the patients we're doing currently as outpatients. When I gave you the number of 80, that is not 80 inpatients. That's our outpatient testing.
Well, that's important.
Yes. And I wanted to stress the reason for the testing being sent more north is, again, there's efforts to reduce the surge of patients in the ER who feel they have symptoms and are coming in for testing. We want to preserve the emergency room for those who truly need emergency care. We won't turn anyone away, but we're trying to triage and ask the individuals in the communities to use these other resources to triage and screen to determine, do you need emergency care or not?
Well, that's important to note. I mean, because this does come down to, and it's a great segue into my next question, which is, you all are separate organizations, and to a certain degree, you're in this space and you're separate organizations, and to a certain degree you're competitors, but in this case I don't sense that at all. And can you talk about how hospital systems can cooperate and work together in situations like this, And before we answer that question, I just want to, if you're joining us on Crowdcast today, we've got a lot of questions coming in from the audience. You'll note that you can vote up questions. So if someone has asked a question and you just love that question, you can vote that question up, which gives me a signal that this is a question that a lot of people want answered. So make sure you check the questions, the Q&A, and you can vote for those questions, and that gives me a better idea of which questions that we can ask if we run short on time. But let's talk a little bit about cooperation among hospital systems and how you guys go about that in a situation like this.
We prior to our merge with University Hospitals, Samaritan and Med Central at the time, we've always been very close working partners. We are in the same NICO emergency response region. So we were partnered in our emergency planning and preparedness for many, many years. I think that relationship has been valuable during this time as well, despite our different organizations. We're all in healthcare for one reason, and that is to take care of the patient, regardless of who we work for. So.
Yeah, and I would definitely echo that. So being in the same region really helps. And there's, as you've heard the governor talk about the different regions in the state and how they organize that work. Ours is that Northeast Central Ohio region that goes all the way over to Akron and Canton area. So I actually reached out to the chief medical officer at UH Ashland just last week. We had a really great conversation, exchanged numbers, so that we had each other's numbers for if and when the surge happens and we needed to get in touch with each other. And then our president, Vincent Yates, has recently started up a kind of a phone call, a conference call with the UH as well as some other healthcare organizations in the region, including emergency management agencies, to really talk about what is our surge here locally. So we're in between. We're in between Columbus and Cleveland. We're part of NICO, but we're on the far western edge of it. So we really know that we need to collaborate between Richland and Ashland counties to make sure that we can handle the surge here locally. So I really appreciate the collaboration I've seen from UH, from our other partners here locally, to talk about how we can really handle the surge and really just share. And we've been pretty transparent. And actually, we just got from the UH president, I think just yesterday, the day before, kind of what their surge plan was as well, which has really helped. It really helps us from that planning standpoint as we look at these new numbers that are being sent out by the state here today in relation to the surge and the curve.
And I've got a related question from an attendee, Mary Kay Pierce, and I think we can just touch on this real quick. And she's asking, is Ohio Health working with Avita during this pandemic? And Jen, you mentioned that you guys are in sort of an emergency response district. I imagine that Avita's in that same district, in that same area, and that level of cooperation is the same between you guys and Avita, or is that different?
Yeah, no, it's the same. So actually, the president of Avita was on that same call the other day that I was part of with our president with UH, and again talking about Avita's preparedness and response. Avita's interesting in the fact that they spread over a couple of different counties. So much like us, many of our central Ohio hospitals within OhioHealth are actually part of a different region. But there's a lot of collaboration across the state, and really no concern from my standpoint that we're not getting the right information here. But yeah, Avita's been fully plugged into that work.
That's great. So we'll kind of move on to one of my last questions before we pivot to audience questions, and that is that these discussions that we're having they can get really heavy. And what can regular people do to help? How can we be good assistants to our healthcare professionals and be good neighbors at the same time? Talk to us a little bit about what the folks on the chat can do. How can we be good helpers here?
Well, first, to thank everybody in the communities for following the recommendations from Ohio Department of Health and the President of the United States. Because of that activity, we have flattened that curve, and we continue to do so. The interesting thing with flattening that curve is, though, we just can't fully determine when that surge is going to happen. It will happen. It will not be as severe as it would have been had we not had these actions in place. So continuing to follow the recommendations from your local health department and state health department is very crucial to the success of our surge planning and caring for patients. We've had tremendous outpouring from the community with donations from anything from masks to food to resources that maybe we didn't have available to us in preparation for this event. So continued attention to the care of yourself, being aware of, are you going out? If so, wash your hands. Basics, but they do save lives. If you're having symptoms, please take care of yourself. Get plenty of fluid and rest and nutrition to support your wellness. I think that's what I have at the moment.
Yes. I think that's well put. And again, the staying home is such a key message right now, and there's a really good reason that I think you just articulated around that. I think in addition to that, there's a lot of ways that the public can help right now. So we know that the Red Cross is dealing with blood shortages. So I think all of our counties have, if you go to the Red Cross website, you can sign up for blood donations in your area. We're having one here on campus this next week, and for associates to be able to donate, but there is a nationwide blood shortage. We do have donation centers for OhioHealth set up all throughout the region. So we have one here in Mansfield for folks who want to donate supplies. We've had manufacturers reach out to say, hey, we have several cases of N95 masks. What can I do to help? Or I have gloves or gowns. And so we've actually set up a donation center. Again, we don't want people to just walk up to that. So if you go to the ohiohealth.com website, there's a section on there about donations. You email them, let them know what you have, and certainly drop them off. We've had lots of food donations and others. We're actually not currently accepting food donations, mostly to protect the folks delivering it and also our staff as well. We really appreciate that outpouring of support.
Right.
So I think following those, the governor's recommendations has been, I think that, staying home and taking care of yourself, and then really taking care of each other, take care of your neighbors.
So we're going to move on to, we're going to kind of pivot towards some of the questions that are coming in from our audience, and they're coming in fast from both of our Facebook feeds as well as here on Crowdcast. So the one that has gotten a lot of upvotes is from Tracy Miner. Thanks, Tracy, for the question. I didn't even think to ask this. In larger cities, there's been talk of turning hotels and other buildings into makeshift hospitals. What's being considered locally, and you've talked around this a little bit, but perhaps do we think that may not be something that's necessary in Richland and Ashland counties? Let's talk a little bit about that.
Yeah, I know for us that we're not looking currently at an alternative site. We've really focused a lot on how we maximize the space within our hospital. So the surge planning that we alluded to earlier really involves how do we find additional space for critical care patients? That's what we're all worried about within the walls of our hospital, to be able to take care of additional critical care patients. And again, what other areas of the hospital can we convert into both critical care and medical beds to help take care of potential COVID patients? So we've really focused on expanding our capacity here within our hospital. You may have heard that within OhioHealth, that they have collaborated with Mount Carmel and Ohio State down in Columbus to actually open up a fairly large alternative site down in Columbus at the convention center. And I'm sure Cleveland is working on something similarly up there. I actually don't know what that might be, but lots of talk about how we expand our capacity here, but not necessarily where we're looking at opening up an alternative site hospital at the moment.
Any plans for that in Ashland with UH?
It's not a primary consideration right now. It is part of the surge planning. The EMA, Emergency Management Agency, that is over the county, really has the responsibility for an alternative care site, and we are working with them on practical locations. But like OhioHealth, we are focused right now on expanding the space and the capacity we have within the hospital.
There's been conversation around using the local hotels as well as boarding for the employees who are going to quarantine themselves in between shifts so that they're not taking anything home to their families. So there's multiple uses for the local hotels, and we appreciate the work, their willingness to collaborate.
I could see that if we're successful here in Richland and Ashland County of limiting the spread of COVID-19 to the best we can, I could see that we would end up being a place where the assets at OhioHealth and Avita and UH might be called upon from your sister hospitals in bigger cities in Cuyahoga and Franklin County. I mean, that it could go the other way as well.
Mm-hmm.
We have another question.
Yeah, I think that's a nice thing about being part of these bigger systems is you do have those tremendous resources, both UH and OhioHealth. It's much tougher when you're one or two hospitals. But when you're part of a big system, boy, it really makes this type of disaster response not easy, but easier than it would have been. Yeah.
We've got a question here from my colleague, Carl Hunnell, here at Richland Source, and he asks, there's a lot of discussion of drugs like chloroquine and remdesivir as potential treatments for COVID-19. The FDA, for example, has approved chloroquine for usage as treatment on an emergency basis. Are local physicians, hospitals, or medical facilities using any of these drugs to treat people with the virus currently?
Mm-hmm. University Hospitals is part of 2 clinical trials right now. And one of them is the recidivir. Hydrochloroquine and chloroquine have been more secure and per the FDA, and to be able to encourage that resource to be available for those who are appropriate for it and not to allow misuse of it. So I can't speak any more to the clinical trial, but we are definitely involved in that and hopeful.
Yeah, so those, as you mentioned, those are 2 of the drugs that we've seen a lot of press around, and we do, our physicians, we have grand rounds where we talk about kind of most current updates from the federal government, and then some of the other there's a lot of learnings from China, Italy, New York, and around the world in regards to that. So definitely aware of their use, and we have had some use throughout our system, and not part of a clinical trial, but certainly aware of those. And again, I think responsible use is key there. When the president first talked about hydroxychloroquine, there obviously was a run. We had to make some adjustments, both with the retail pharmacies as well as within the hospital, to make sure that we preserve the supply of that, which we did.
This is a question from Pam. I'm gonna butcher your name, Pam. Pam H. Jordan. I'm not even gonna try, on Facebook, and she's wondering about the supply of ventilators that are on hand at Samaritan UH and at OhioHealth.
Mm-hmm. We have to report our ventilator supply multiple times daily up through our system and also to the ODH. Just like probably many facilities throughout the United States. I mean, do we have enough for a surge of thousands of individuals? No, we don't. But we do have ventilators available to us for those individuals, and there's clinical decision making that will potentially need to take place in the event that we have more patients than we have ventilators. So that leads to a difficult discussion with family members and the care that should proceed. We also have resources available again throughout the system. If need be, if there's a surge quicker up in, say, Parma, then, our resources would potentially shift to their location to be able to take care of those patients and vice versa.
Yeah. So I think very similarly, we currently have 30 critical care beds at Mansfield, but we've worked on plans to be able to expand that almost threefold if need be. Now, to say that we could expand those beds, then you have to find staff to staff those, and then obviously equipment to supply those as well. But right now, we're working with both NICO as well as with the Ohio Health System to help make sure that we have enough supplies, including ventilators, to staff those beds and supply those beds. So nobody knows what that surge is eventually going to look like and how many ventilators we might need, but we feel pretty confident about our ability to more than double, almost triple the number of critical care beds that we have in Mansfield. And then in addition, we look as a system and see where do we want to focus our resources at our 12 hospitals within Ohio Health to make sure we really maximize who has the most critical care nurses and physicians and support. And let's really shift resources to those sites so that we can really maximize the amount of patients that we can take care of in the proper way.
This is a question from Ruthie Good, and I thought it was an interesting question. And thanks for Christina Thompson for commenting on this with a link here that we'll drop into the chat as well. But Ruthie asked, I think this is related to what you had mentioned earlier, Dr. Baumgartner, about testing. If someone thinks that they need to be tested, but they don't have a family doctor, and you don't want them to come to the ER, what should they do?
Yeah, so, and I think probably Christina put up, there's a link on ohiohealth.com that actually has a screening tool that you can use, and then a guide as to where to go. And I think Kathy or Jen probably mentioned earlier around the ODH sites. There's actually a hotline that they can call through Ohio Department of Health and actually talk to somebody to get some advice about that. Because as as we mentioned before, we don't want everybody coming into the ERs, both for their own benefit as well as the benefit of the resources that we have within the ER to protect them as well. So if you can be treated as an outpatient, we certainly want you to do that. And so using the ODH site and or going to the ohiohealth.com to use the screening tool would be probably the best way to go. I assume that's probably what Christina put up on as a response.
Yep. How about in Ashland? Is there any different, pretty similar to what Dr. Baumgartner recommended?
Yes, the Ohio Department of Health hotline is the preferred method. The local health department is available too, but they are fielding calls of the individuals that they are already monitoring and tracking. So their resources are dedicated to those individuals that have already been tested, or they're trying to monitor for potential outbreaks. So again, although you have a local health department, the request is that you call the Ohio Department of Health hotline.
So let's talk a little bit about supplies like N95 masks in Richland County and Ashland County. Do you, our reader Beth Malaska wanted to know, do you feel prepared with the proper amount of PPE and tests for COVID-19, considering what we're being told is we're moving into a peak season? So I think Beth's just asking PPE supplies, testing, all the things that you need to care for people. Do you feel like you're prepared and stocked up?
Yeah, I'd say that within Ohio Health, we have our main command center down in Columbus at our headquarters, and then we all have, as we mentioned earlier, command teams working with each of our campuses, both at UH and Ohio Health as well. So our main command center is working daily. They actually have a team of folks working every day to assess our personal protective equipment, what we call PPE, and other really critical supplies, like IV fluids and antibiotics and other things that we might need. So we feel good about where we are. Again, everybody's seen the national news, and it's just a hot topic every day that we all deal with and we field calls on. Again, not knowing what the surge looks like and how much we need, we are constantly looking at how to preserve and conserve our protective equipment. And one thing I'll add is that we were able to partner, and I think probably a lot of folks have seen it because I think it's hit national news now, but Patel, which is a science and commercial think tank down in Columbus, was able to develop a process using vaporized hydrogen peroxide to reprocess N95 masks as well as goggles and face shields. So Ohio Health was able to pilot that with them, and actually Mansfield with one of the initial pilot sites. We've actually used some of those reprocessed N95s and face shields and goggles already. We've been recycling those because it is critical. We know that it's a finite supply, even though manufacturers have kind of ramped up and we've all looked at supplies. But that kind of Excel ingenuity and innovation is going to be key to us preserving and conserving our PPE supply.
I'll echo what Dr. Baumgartner indicated about Battelle. University Hospitals is looking into utilizing different resources for reprocessing the PPE. There's other avenues. I'm not sure that they're public or FDA approved just yet, but there's other opportunities that are looking to get FDA approval for that as well. Do we have enough? Yes. At this time, we have enough. We are working hard to be thoughtful about the PPE that we use and at what point in which patients we use the PPE for. So,
you know, one thing I would add too, and I'm sure that we're not the only ones doing this, but we're really looking at on that conservation preservation side. So we're taking some really innovative steps now. So we've had the ability, and we've actually done telemedicine. So using video conferencing to be able to do visits. But now it's taken on kind of a different slant. So we're doing that even within the walls of our own hospital so that a specialist or a physician or another staff member can communicate with a COVID patient potentially without having to put on the gown. So the patient might have an iPad, the physician or the staff member might be at a desk computer with a WebEx cam or a webcam, and they can communicate with the patient without actually having to go in and put on full garb, which then, again, I don't want to say wasted, but it would use another gown or a mask. And so I think we're looking at all kinds of measures to preserve and minimize the use of PPE so that we can handle that surge that's coming.
We've got, let's see here. From Angie Lettingham on Facebook. She wants to know if you feel that, and I think that this is for both of us, and I don't know that she's asking just about hospital systems. She might just be thinking about our communities in general, but interested in your viewpoint on this. Do you feel that Mansfield and Ashland is ready for what might come? Are we being realistic? Do we understand what this virus is, what it can do? Are we ready? Are we prepared, do you feel, as a community?
Yeah, I'd say we've learned so much over the past month. It is truly amazing the curve of knowledge and learnings that we've all had. I'm talking just science and the medical community in general over the last month, our understanding of the disease, what folks from China and Italy, France, and other parts of the world have been able to share with us in today's day and age of a 24-hour news cycle. So what I feel like we have a much better understanding. We certainly do not know everything, and we won't know for months or years everything about this virus. And this is really an epidemiologist's dream, this scenario, unfortunately, right now. And they'll be learning from this for months and years to come. But we feel good about, I think, the collaboration with the other healthcare organizations, the state and federal government is really unprecedented. I've never seen anything like this in my 20 years in practice. Really refreshing to see. And so none of us could do this on our own. But I feel really good about how the collective is looking at this and tackling this, not in silos, but as groups of regions and states, and including the federal government. So we're not there yet. But we do feel really comfortable with where we are along the planning and execution phase of managing this surge.
Is this something that we've experienced before? No. I hope to not go through this again. But again,
we all do,
right? But as Dr. Baumgartner spoke to the teamwork and the putting down the whose side are you on and the collaboration, because we're all in this for each other, and to focus on the care of the patients and the survival of as many as possible.
I have a This is an interesting question that just came in from Ruth B. Good, and this is, again, we're talking about a population that might not have access to the internet. Is there a plan to treat homeless people who, folks that are suffering from homelessness, or are, they don't have a place to live, they're a marginalized population? What are their treatment options on this? Because there have been reports coming out of places like Seattle, and where there are large populations of people that are homeless, where the virus is just rips through those communities because of the lack of sanitation or the lack of access to care. I know that isn't a huge population here, especially in perhaps in Ashland, but it's a larger than you would think population in Mansfield and Richland County that are in those kind of circumstances. What are their options for treatment?
Yeah, so they'll be treated if they need hospitalization. They'll come into our hospital and be cared for like any other patient. The challenge then comes with discharge planning. So many shelters have restrictions on COVID positive patients, and we found, much like nursing homes and other facilities, want to make sure that their residents there are going to be safe. So we've actually looked at with OhioHealth, and actually in collaboration with health departments in the state, really looked at our options for once these folks no longer need hospital care, where can we safely house them until they're safe to return to a shelter or to where they were previously. So we definitely are looking at plans as a system in conjunction with health departments as to how to deal with that population. We've actually had some of those cases down in Columbus where our system has had to think about, we don't want to keep them in the hospital because we want to keep the hospital beds open for the sick patients who need them. But we also don't want to put them back out on the street into an unsafe environment. So we've worked on some creative ways as a system as to how to get those folks the care they need and the housing that they need until they're safe to return to a shelter situation.
We have a very small population, as you spoke to, Jay, here in Ashland. I can speak to the one case I'm familiar with. That again is where the hotels and motels have been able to offer assistance to these individuals with the local health department, so that they have the appropriate amenities needed to take care of themselves while they're going through that.
Got a question here that just came in from, let's see here. They're just coming in pretty fast, so forgive me as I look through this. Dr. Baumgartner, you answered this question a little bit earlier, but I don't think we actually I don't think we asked it of our friends at university hospitals, and that is from a reader who's watching, how many ICU beds are available at university hospitals and at OhioHealth? And I think, Dr. Baumgartner, you said you had 30 critical care units and you're preparing to staff up to 90 if necessary, but I'm not sure that we asked that of our friends at university hospitals. So how many ICU beds or critical care units are available there?
Well, again, we're much smaller. So at the facility level, we have an existing 8 beds, but again, the surge plan does escalate that, and we would triage accordingly. So our inpatient unit, the med surge unit, that has 28 beds, so that would then be utilized. We have other departments within the facility that would be repurposed, such as the recovery room, or even an OR suite could be utilized as an ICU unit. So we have multiple different internal locations that can be repurposed for intensive care. And the goal with the surge plan would be any of the individuals who are not requiring intensive care but still require care, they would potentially be relocated, as they would be easier to relocate to off-sites and whatnot.
And I think it's worth restating something that you mentioned earlier, Jen, which was that so many employees inside your health systems are being repurposed right now because they aren't doing what their normal job is. For example, elective surgery, or sports trainers, or folks that are dealing with a different kind of a health issue where the effort is focused on COVID-19. So if you're not doing elective surgery, that means that you have more ORs open, which is more square footage to turn into emergency ICU units if that's there. And I hadn't even considered that, that flexibility within the facility, and I wanted to make sure that we restated that.
Yeah. Yeah, if you think about when we do have surgeries going, there's an anesthesia machine. That anesthesia machine essentially is a ventilator, and that can be utilized as well as that resource. So, and there's different techniques out to utilize a ventilator for more than one individual if necessary. There's, of course, a lot of clinical criteria that would determine that ability, but there's unique and innovative ways to utilize the equipment in more ways than anticipated.
We've got a question here that came in from reader Steve Cummins. I know Steve, and I know that he and his family have operated a manufacturing company, Mansfield Engineered Components, out by the airport in the industrial park for at least 2 generations now. Steve, correct me if I'm wrong on the generational component. But Steve asks, local manufacturers are eager to assist, but those of us not familiar with medical supply don't necessarily know where to start. In coming days, we'd welcome any suggestions or guidance about how we can assist. Perhaps this might be something that you guys can speak to a little bit, at least in terms of inquiries you've had from manufacturers who want to assist and want to help, and where you might be referring someone like Steve to.
For university hospitals, there's an entire department up at main campus that's dedicated to the innovation and the needs of the facilities and the system. So we would be able to refer these individuals and companies to that department as a resource for potential needs.
Yeah, and almost identical. We have both a donation center, and if you go to the OhioHealth.com site, I think it can point you in that direction. And then we're also taking ideas. So we've had, as an example, we've had just countless folks, hundreds of folks from the community down in Franklin, Richland, Marion County, other counties reach out about sewing. So we have a lot of folks at home with a little bit of extra time in their hands who are particularly skilled at sewing. Can I sew masks? And so we actually have, that's what that website's for, because we can't take all masks. So there are some that we've taken. So we actually have now an army of folks out in the community sewing masks for us as part of our donation center. And then that innovation center has been great. We have one similarly. We have ideas come in all the time, both from within our own ranks of associates who say, hey, I wonder if we could do this. And then also folks from outside who say, I went online and I saw a plan for a simple ventilator, and here I made one. What can I do with this? And so we're taking all ideas right now. It's all hands on deck.
I want to take that moment to recognize another local manufacturer, Hess Industries. You may or may not know Mark Hess and his team out there, but they do complicated machining that frankly I don't understand. But some of the things that they have are things like 3D printers, and Mark's engineering team figured out a way to build a 3D printed door opener that allows you to open a door with only your forearm. So you don't actually have to touch the door or the doorknob or any of those things, but yet you can still activate the doorknob and move through the door. And I think that's just, I was really inspired when I saw that, but it was emblematic of the effort and ingenuity that's coming out of part of sort of our communities of makers, whether they're making masks at home with a sewing machine or they own a manufacturing or an engineering company and they're reaching out to try to help during this crisis. So thank you a lot for the question, Steve. It looks like Christina Thompson from Ohio Health has dropped an email as a comment to your question, Steve. So supply donation at ohiohealth.com.
And Jay, one thing I'll add on is, and I think you were kind of alluding to it. So there are some really good things that will come out of this horrible situation that we find ourselves in at the moment. This crisis that we find ourselves in, both professionally with things like telemedicine that have been, that's really been advanced greatly, to some of the societal, benefits that we've seen where, many of us get to reconnect with families. I have a 16-year-old and 11-year-old that I haven't had as many family dinners with over 2 years as I have in the last month because they can't be heading out with friends or going to soccer practice or what have you. And I think some of these innovations are really how industry is collaborating with healthcare right now on some of these innovations. That is a real benefit that we're seeing now that I'm really confident is going to stick in the long term. So what you mentioned there with your manufacturing friends that created that type of device to open up a door, we're going to see more and more of those pop up. And I'm really encouraged by that.
We've got a question here from Sandy Nye on Facebook, and that is, Sandy asks, how soon should we expect more COVID-19 tests to arrive in Ohio? And I know that you guys have spoken a little bit to testing earlier and that you feel like you have the test kits that you need at this time, but Sandy may be speaking more in a general sense for the state of Ohio. Can we talk to her a little bit about what that looks like and what our expectations are?
Yeah, so I actually don't know what ODH's allocation of tests happens to be. So I don't know that I could speak to that, but we actually, and again, we mentioned our command centers, I would imagine much like UH, they're constantly looking at our supply chain. And so we're getting shipments of PPE and tests in daily, if not weekly, to help replenish our supply. So we actually feel pretty good about where we are with both of those at the moment. But again, not knowing what the surge is going to bring, we're constantly working to increase our numbers in both PPE and in tests. Mm-hmm. So I don't know about the state of Ohio, though.
I don't have anything additional to add to that as well. Again, with the manufacturers who are creating new testing methods, they would be identifying the components of that test as well. So it's hard to predict how many we are going to need, but again, with the triage of individuals needing tested to be able to care for the individuals in the community, that's helping us manage that supply. Again, we understand it's a very concerning time right now, but if you just have, say, minimal symptoms, I'm not discounting how you're feeling at home, but, if you have those symptoms, just try some self-care at home first. Don't just automatically think that you have COVID. Manage yourself at home until you have concerns that you maybe are not able to do so. And at that point, you would, speak to your primary care provider for further guidance on whether you should or shouldn't be tested.
And we've got a question here from Christopher John Snively on Facebook, and he asks, how many people who had a flu shot got the virus or passed? And I think I'd like to restate Chris's question just a little bit to talk about some misinformation that has been out there, at least early on, and it might be worth it restating it today. Is if you got the flu shot this year, are you protected from COVID-19, or is it a completely different thing?
Completely different thing. They're both viruses, but the flu shot each year is manufactured based on different strains and different components of the flu virus to be able to eventually, over time, protect you from the various strains. And we are seeing individuals who have tested negative for COVID, but positive for flu. There are individuals who have tested positive for flu and positive for COVID. So they are two different things.
Yeah. And I think a big question that came up at first was around that co-infection. So can you have the flu and COVID together? And what's the incidence of that? So how many cases do we have of that? We won't know that one for a while. Once the epidemiologists get a chance to really do a retrospective, a look back on this pandemic, we'll have a much better sense. And also, until we do much more widespread testing, we also won't have a really good sense of that as well. We're really testing mostly symptomatic patients right now and prioritizing those that are the sickest and healthcare workers, frontline workers as well. So really good questions though, but it's going to take a little while to get the final answer on those.
So we'll have our last question here, and this is from Amanda Lee Smedley on Facebook, and I think that this is a good last question because it's one that will speak to what's probably coming down the pike here from the government pretty soon, and that is, Should we be wearing masks out in public every day if we are an essential worker?
Well, that's actually, so the last part you said, essential worker, that may change that answer maybe a little bit, but you're right in saying that there's I think a really good question right now around masks, and our stance on that, and I say ours, not even OhioHealth, just as a state, as a nation, has really evolved over the last few weeks as well. So a couple weeks ago, we would have said probably not. Now we're leaning more towards probably, if you're out in public, essential or not, it may be a good idea to wear masks. Now, and you may have heard that the governor and possibly the president may be coming down with a mandate in the coming days around, or a recommendation around wearing masks in public for the general public. We've gone, so OhioHealth has gone now to requesting that all of our associates here within the hospital wear masks when they're out and about in the hallways and outside their offices where they can't maintain any kind of a safe distance. In addition to those frontline workers that have been wearing masks and protective equipment from the get-go. So I think I'd stay tuned to the CDC and the ODH sites on recommendations right now. What I've told folks is that, and this is kind of evolving and changing, is that if you are symptomatic and you absolutely have to leave the house, you can't stay at home, so you have to get out to the grocery store, you can have somebody go for you, you have to get out to a doctor's appointment, whatever it might be, you should wear a mask to protect others from you. Now the question is really evolving into, what is that asymptomatic transmission of the virus? We haven't really known that to this point, and we won't truly for a while, but there's enough studies coming out now, enough anecdotal evidence that's now pointing towards there are a lot of folks who are not showing symptoms of COVID-19, but can actually transmit the virus. So I think that's really going to be the question. I didn't give you a direct answer because I think I'd rather wait for, I think, the governor and the president to give that mandate. I'm not going to give medical advice, in this format, but I would say stay tuned here to ODH, to the governor's 2:00 press conferences, and to the president, because I think there's going to be some pretty strong recommendations come out in the near future.
Well, you heard it here first, folks. That we may have just gotten a preview. So I want to really thank our guests who were probably on certainly one of the best attended Corona conversations, and inarguably the most important, because it's dealing with our health and our well-being as a community. I want to thank very sincerely all of the members of the Source Media properties, no matter where you are, Ashland, Mount Vernon, Mansfield, Shelby, Lexington, wherever, Ontario. Your support and the support of our corporate partners is critical to bringing this local journalism to you in ways just like this. And if this has been enlightening to you, I want to encourage you to do a couple of things. Click the follow button in your screen so that you can be notified when we are going live next week. We've got a great slate of guests and topics next week that we're going to talk about. I'll share that with you in a second. If you're interested in supporting our reporting and supporting the work of Brittany and Carl Hunnell and her colleagues in our newsroom, click that beautiful green support our reporting button on your screens. That allows you to become a member of the Source, and we really appreciate it. We want to thank the Facebook Journalism Project for supporting this work, and I want to tell you a little bit about what we have slated for next week. Next week we're going to do a special Mount Vernon edition with the mayor of Mount Vernon, Matt Starr, and our reporter in Mount Vernon, Grant Pepper. We're going to talk about, we thought we were going to talk about taxes, which we probably will a little bit, but we're also going to talk about all of the incoming knowledge about the PPP programs for businesses and what we need to know right now with Tanya Baird of Willis Osmond and Beilstein Accountants. We're going to talk with Chris Hirschberger and Amy Sechrist and Anna Marie Ferniak about if your gym is closed and what are your options for managing self-care and managing stress. We've got a great one going up with cooking essentials, gardening, and creative cooking. We're all at home now, and we're ordering takeout a lot less than we used to. We're certainly eating out a lot less. We're working on a session that we don't have people booked for it yet, but we're working hard because we'd like to talk to you about investing. If your 401k has tanked, which all of them have, what are good general pieces of advice that you can use moving forward from there? And it looks like we have Lee Tassif from Destination Mansfield booked for Friday, which is what to do. What is there to do that is COVID-19 compliant? How can I entertain myself during a month-long shutdown? So we've got a great week next week. Again, thank you very much for attending this week, and we'll see you next week on Coronavirus Conversations. Again, thanks to our guests, and have a great weekend. Stay safe out there, and thanks for supporting independent local journalism.
Be well.
Thank you very much.
Bye-bye.
Thanks.